I'm a surgeon, and I live in a very comfortable environment, but once in a while I exchange these safe and comfortable environments with a work as a war surgeon, working for international humanitarian organizations, providing medical assistance to victims of war in armed conflicts around the world. And as you can see, those settings are, in general, more basic, more simple, and the environment is more insecure as it's at home. As you can see on this picture, it's a patient I operated about almost 20 years ago in Rwanda. This poor chap, I had to remove bullets from his chest and his bowel. And as you can see, I did this in a barn on a plastic sheet and on a wooden table with one anesthetist to help me to do that surgery. And why did I do this there? Why didn't I bring that poor chap to the hospital? In 1994, Rwanda, there was a massacre. Hutus were killing Tutsis by great numbers. Almost 800,000 people got killed and massacred during the time I was there. And if I would have brought that chap from the bushes to my hospital, I would have been stopped at the nearest checkpoint. They would have unloaded my ambulance and they would have killed that guy on the spot, which happened several times before. I worked also in small remote hospitals outside in the field in Rwanda, and we got raided by armed forces several times. They entered our hospital, and although we worked day and night, sleeping underneath the operating table, my Canadian colleague and I, they entered the hospital, they checked the IDs, and if they found Tutsis, they killed them on the spot. I thought this is an isolated incident in my career. And I moved on and I participated in several other conflicts around the world. But I realized it's not an isolated incident. I encountered same problems in Liberia, Sierra Leone, in Somalia, Sudan, Afghanistan. And I thought, what's the problem? And it got worse over the last 15, 20 years. And why? Because over this period of time, the war has changed dramatically. You're not encountering anymore big organized armed groups and police forces we can discuss and they respect the emblem of the Red Cross. No, those are the guys who are roaming the streets, kids with arms and on the drugs, small armed groups, bandits, predators looking for an easy prey and preventing my patients access to the hospital, looting our drugs and our medical supplies, misusing our hospitals as headquarters and command centers, and in the worst case, attacking our patients. But this is only one problem. The other problem is, at that time when fighting increases, what we are doing right now, what we did increasingly the last 10 years, is we evacuate our staff, because it's too dangerous to leave the expatriate there in the field. And the consequences are that expensive humanitarian projects like vaccination programs for polio and measles, one of the biggest cause of child death, for example, in Afghanistan, are stopped and halted and people are evacuated. We have many, many more increased malnourished children in southern Afghanistan just because there's nobody there anymore to take care because of the security situation. So it's a problem which is most probably one of the most least understood and most imminent problem in humanitarian, especially in healthcare in war zones. If you look at the statistics, you can see it proves, done by an HPC study, that over 300 incidents were reported. A more recent study done by the Red Cross actually proved the double of the incidents over the last 2.5 years. And if you look at the statistics, you see that after 2009, the curve is going down. But does this mean that we have found any solution to address the problem? No, that's not the case. The curve is going down because more and more international organizations like the UN and the International Committee of the Red Cross are downsizing their programs and retreating their stuff. So, as in summary, I have to say that healthcare at the moment is the first victim of war. We retreat at the time when we are most needed. Because when they send a doctor into the field, it's because either the healthcare system has collapsed or the healthcare system is overburdened. And when I have to go into hiding or I have to be evacuated, like it happened recently in Afghanistan, because one of our doctors got killed in the tribal area close to the border of Afghanistan, Pakistan, then actually I ask myself, what I'm doing here, what I'm here for, I'm here to help. I'm an expensive doctor. I'm leaving my clinic and I try to help and I can't do my job. Wait a minute, we have the international humanitarian law and it protects healthcare all the time. And most of the international organizations who try to address this problem are exactly pointing to this. They're creating new resolutions, conference. They try to convince the public and international organizations to take care of, to respect the international humanitarian laws. But if you remember the last picture I showed you with those kids with arms, how on earth are you going to convince those guys to respect humanitarian law? Because they're kids, they hardly read and write, and they're just going there for an economic gain, and they're not going to give it up. So we came to the conclusion we have to do something against it. And the sad reality is actually that small armed groups, bandits, which are the greatest threat to humanitarian healthcare organizations, actually only respect something, and this is armed authority. So we thought we were going to create a private organization, a private foundation, private humanitarian foundation called Swisscross, which is going to put together the first humanitarian security on this planet. This will be done in collaboration and support and legitimized by hopefully the Swiss federal government. And why the Swiss government? Because Switzerland has no history of colonial or imperial past and is home of many international humanitarian organizations. This group, this security formation, would consist about 150 to 200 men and women and could be deployed within 72 hours wherever they needed on any disaster area on this planet. How would this look like, this lightly armed civilian security? They would go there and they would try, the first thing they would try is just to shield the hospital, the medical installation, which is essential for the survival of the local population, through armed fences. They will build up fences. They will reinforce the roofs with sandbags. They will install video cameras and lightning and barbed wire. And they will create an access which is controlled by those lightly armed persons, because they are not there to lead a war. They're just there to protect that hospital. And every patient and a company family member will be disarmed and will be checked, and only then will enter the premises. And so you can create a kind of law and order within and outside of the hospital. Of course, you cannot accomplish this without the support of the local authority and all the stakeholders and parties involved. You have to convince them that this group is just there to following the basic humanitarian principles I have to follow as working for an international humanitarian organization. That means we are impartial, neutral, and independent. We have no political agenda, and we're just doing that to protect us, to protect hospital, healthcare facilities, to protect patient transport, so that our patients and victims of war get safe to their destination, even have to, or can be picked up somewhere safely and brought back under protection of this Swisscross protection. And of course, even medical supplies have to be protected, because if you have no drugs and no bandage and no medical supplies, you can't do anything useful there in the field. So Swisscross Protection Unit is actually the first security force which was explicitly supported, explicitly trained and supported just for humanitarian purpose, just to protect medical installations. And they are no army. This is no army. This is no police force. And they are civilian under civilian contract, and they will work there, will do their job there on request, on approval only by the local authority. Wait a minute, but aren't there other means and options to protect humanitarian installation in the fields? Haven't we done this in the past? Yes, of course. The government has their own police force or military, and there are even local security forces available on the ground. But those are not neutral and not impartial, and they only have their own agenda. And if you need soldiers, like it happened in our camps in the Chad, and fighting is going on, they're going to call for their soldiers, and the soldiers will abandon the camp, the hospital, whatever it is they have to protect, and will leave the doctors and everybody there alone. And UN missions are very complex. Are very complex structured. They need mandatory UN mandate by the Security Council. And this complex procedure takes up months, if not years. So to say, actually, in general, they arrive too little, too late. And so we need something during the time where we have most casualties. And the most casualties are in the beginning of the conflict. You don't send the firefighters when the house is completely burned down. So Swisscross, they don't depend on a UN mandate because they're just protecting a hospital and a few staff and patients. That's it. Every oil company, every mining company in war zones has their own security on board. So why shouldn't we protect the most important, most valuable assets to me? Those are the victims of war, the weakest, the patients, and the sick. If you create something like this, you have to know that NGOs and humanitarian organizations are actually reluctant to work with arms. And International Committee of Directors would never work together with people who are armed around this. But if you create this, and you don't start with wars and complicate the conflict, you start with natural disaster. You go there in an insecure environment, and you just create a little bit law and order. You distribute food and blankets in an orderly manner. And then you build up from there. So we create a kind of perception and a credibility. And with this credibility comes the acceptance, and with the acceptance comes the security. Imagine if you just wouldn't go only to protect hospitals. Maybe at one stage, if this is successfully and accepted by the NGOs and any others, we can go on further and protect refugee camps with several thousand people. And if this works too, we can go on and create kind of humanitarian embassies. Because you saw in the beginning, we, as the white people, we always have a way, there's always a chopper waiting to evacuate to somewhere. But the locals have no way to go. They're there with their family stranded. And if you leave those people alone, and if your wife and your children get raped and killed in front of you, you get radical. You're going to get an arm and you're going to shoot somebody else. So how to prevent this? Let them enter into a humanitarian embassy. They will be protected by something which follows these humanitarian principles. And you can de-escalate war. This kind of way to address these problems would definitely change the course of war, any war in the future. Do we have any alternatives? So far, I haven't found them the last 20 years. I've witnessed so many incidents, and I've witnessed so many disasters. I will never forget this hospital. Next to my hospital, there was a small schoolyard, and there were about 100 Hutus craving together. And there was a barefoot Sri Lankan UN soldier with an old rusty gun. He was protecting them. And the Interahamwe was looking over the walls and always watching them. And one day, this small little soldier had to leave his post, and he was called back. Next day, he looked into that schoolyard. Everybody who was there was dead. There were 100 people, little kids cut into pieces. Everybody was there. And I said, I can't believe that this little soldier with his rusty gun had the authority to protect those people. So we see, witnessing kind of this puts me into a kind of responsibility, and I have to engage. And that's the reason why I'm engaging with this Swisscross project. That's the reason why I put so much time and effort to talk with governments and an international institution. Because the next war is going to come, and the next war is going to pass by, and if you don't act, there's going to be another missed opportunity. Thank you very much for you.